Hi, class. My name is Joanne Mejia, and for the current event this week, I'll be discussing a comparative study titled The Protection of Citizens' Right to Health Focus on the Public Health Policy of Korea and the USA. It was published in March 2019 by the Asian Journal of WTO and International Health Law and Policy. So, in this study, the author starts with discussing that a nation has two options to address the health financial burden. One, the government could leave the right to health to the people with little involvement from the government. This would mean that citizens who are not able to afford treatment are not guaranteed the right to health. Two, the nation can take responsibility in securing universal health care. And this would mean that it would be providing people with basic protection from diseases or injury, regardless of their social status or wealth. The Constitution of the Republic of Korea states and adapts the right of health as a fundamental right of the people. In order to implement the citizens with the right to health, Korea adopted national health insurance in 1977. First, they implemented a policy that was applied to businesses with 500 employees. Then coverage expanded to rural populations, then urban self-employed population in 1988 and 89. So this eventually led to national health insurance for all. So after this was done, all Koreans, uh, it was mandatory for them to enroll in the national health insurance. And then after this, they would pay premiums depending on their income. So at the same time, all medical institutions were also enforced into the national health insurance system. But just like everything, there are positives and negatives. The negatives being with the government involved that would limit a person's freedom. So in Korea's case, it would be choosing the national health insurance and making it mandatory for all citizens to register and pay a mandatory fee. So, if such a small country like Korea can guarantee its citizens the right to health, isn't it strange that one of the most or the most powerful nation in the world cannot do the same for its people? Instead, the US has Medicaid for low income, Medicare for the elderly, and private insurance mostly provided to employed citizens. So there have been attempts to have universal health care by presidents including Truman, Clinton, Reagan, and Obama, but historical and political challenges have led to the issue being dropped. So the United States Constitution does not clearly indicate health rights. Do you think for this reason there isn't a free medical care system for all of us? So the authors of the study went on to imply because some rules don't exist doesn't mean there is no need for explanation or interpretation. So there, in the United States, we have a federal Supreme Court that helps us with the review and interpretation of the law. So furthermore, there is the 14th Amendment that grants all born citizens and naturalized equal protection of the laws. Also, there is the Ninth Amendment, and that indicates that there are other rights that may exist aside from the ones mentioned, and even though they are not listed, does not mean they cannot be violated. So this could be interpreted that citizens have a right to health. So this is important to me because, in the beginning, I started taking this class as an elective to fulfill for my degree in health information. So I had heard about health insurance for all, but I didn't really put much thought into it till I started taking this class. So since then, I have been curious and intrigued, wanting to know more what other countries are doing and how it works. So this is the reason I chose this article because it explains and it gives reasons to why we don't have a health plan for everyone, how close we came at times to having one, and how we can start on having such a plan if the United States chose to. So I would like to leave you a few words from Barack Obama. Healthcare is not a privilege for a few, but a right for all. Thank you for listening.